Thank you. Ray, just to be clear, are you saying don't ever get your clothes dry cleaned again? Or are you saying something else?
So I'll tell you what I do. I launder all my shirts, so that's washing it with water. So the whole purpose of dry cleaning, just to be clear, the purpose of dry cleaning is so our clothes don't shrink. So we're dry cleaning is so our clothes don't shrink. So launder all my shirts, and then I don't use a dry cleaner that uses perchloroethylene. I use a green dry cleaner. Um, I'll give you a story. Because these chemicals are volatile, they are released from dry cleaners. So in New York City, there's lots of high rises, apartment buildings, and at the bottom of these high rises are dry cleaners. So they've done studies in New York City in which they found unsafe levels of this in the indoor air of the apartments above dry cleaners. Second, because it's fat soluble, you open the refrigerator and you look at the butter and the cheese, and you have this and the butter and the cheese in your refrigerator in your apartment above a dry cleaner in New York City. There are homes in Southern California, in Newport Beach, California, less than a half mile from where I went to high school, that have this and this in the playroom of multi-million-dollar homes in Newport Beach, California. These things are known to cause cancer. So would you asking me, would I avoid dry cleaning with trichloroethylene and perchloroethylene? Absolutely.
Okay. And also, are there natural medicines for Parkinson's? Is there an herb that you can use?
So there have been a couple studies. Vitamin E, coenzyme Q10, been both the best studied. Vitamin E shown not to be helpful. Coenzyme Q10 thought to be a benefit early in early trials. I like Dr. Pai's desire for rigor in a larger clinical trial, not shown to be beneficial. These were all after people were diagnosed. We don't have a good sense of things to prevent or slow or possibly delay. We just haven't been, we don't have the tools really to study that effectively. But the short answer is no, but Mediterranean diet and exercise, avoiding nerve toxicants in your food, water, and air.
Thank you.
And if I can jump in there, just because I want to add on to what Ray is talking about, is that some of these things with these chemicals are so bad that it's a larger discussion of like nobody wants to talk about it, because it's the chemical industries, right? Like, so when we talk about forever chemicals, or now we're talking about nanoparticles or plastics, and then he's talking about, these are so commonly used in every city, in every place, that there's a huge industry. I mean, even EPA has difficulty with regulating a lot of these things, even with the latest studies on some of these, I think it was the forever chemicals, and also the chemicals that were in plastics just recently. I don't know if you saw that with EPA, is that it went all the way up to court, and then they got tagged on a like a little loopholes. Like the court said, yes, we know that these chemicals are damaging, and not only to the people, but to the environment, but we're not able to regulate it because that also might hurt an industry for economics, because everything's about economics now these days, right? Is that they don't want to regulate it. So there's a little bit of a challenge because there is options, and I'm sure like he can, as he pointed to, there's green cleaners, but it's harder to find a green cleaner if you don't live in a place that may have that. And unless there's regulation to push that, people would want to go with something cheaper, maybe, which is more harmful. So I think it's great that he's talking about these chemicals, because people need to look at it. It's like by them choosing how they shop or they buy or they consume their goods, that also changes the industry, because the laws are never going to be fast enough and quick enough, and they'll be always probably challenged, so that it'll be slow, so that that protection won't be there for the public. But the public can take a proactive approach immediately by saying, like what he's saying, well, I'm not going to do this, and that can change a lot in the industry, because then people would want to fill that void with maybe something safer.
And
Thank you.
just on the dry cleaning, so I used to think, how big of a deal could it be? Because I was thinking about my world, how often do I get anything dry cleaned? And the answer is not very often. Then I got emails from people who said, my husband worked every day in a blue collar job and was wearing a dry cleaned outfit every day for 30 years. And then, you might look at this in a different light. And closed off gas, they release these chemicals. When you bring in your dry cleaning into your car on your way home, you'll be breathing in these chemicals. When you put it into your closet, you're going to be breathing these chemicals. So I get really concerned about it. And we have to say, to what end? We used DDT in World War II to prevent malaria. Okay, we'll take the trade-off between malaria and DDT. But are we going to really take the trade-off between causing leukemia in kids and having our clothes not shrink?
So if I have a suit that went to the dry cleaner and it's hanging in my closet in the plastic, should I throw the suit out, or should I, like, what do I do? Is it like,
Well, again, I'm a neurologist. I'm not an environmental scientist. I'm not a dry cleaning expert. I've learned more about dry cleaning than I ever cared to learn. I would take the suit outside, let it air out for some time, and then before bringing it into the home.
okay, so Dr. Rao and Dr. Pai, so you've been doing this a while. So if you had to put together the last 1,000 patients that you each saw, and that followed what you said, the last 1,000 patients you saw in your practice that followed what you said, what actually happens to their weight, their blood sugar, their cholesterol, their blood pressure, and other key metrics? Did everyone get perfectly healthy, or did some people, their blood sugar or their weight or their cholesterol is stubborn and it just didn't respond enough? And then at that point, what did you do?
I want to go some. Yeah. So I think that, like when I said before, was everybody's journey is very, very different and unique. I think that it also depends on when they've started their journey versus when, if they're mostly well. But anything from not having a diagnosis to having a diagnosis, I think can make some improvement in quality of life. Whether or not you reverse your actual diagnosis is one thing, but you can change markers of inflammation. You can lower fasting glucose, insulin resistance. You can lower lipids. So it's not all black and white, but what does consistently happen from the last, say, significant amount of patients that listen to me are they're blown away by the power that lifestyle has. And they had no idea. And that is a consistent message that I get, whether they're completely reversed or just their weight goes down or just their insulin resistance goes down. Mostly everyone is, I had no idea that I had so much control over my health destiny and how much I could do to make a change, and how simple some of these things are. And so I think that is more of a consistent message than the actual numbers or changes in blood pressure. Now, metabolic syndrome, neurodegenerative health, even things like cancers, and some of them don't budge sometimes with the things that I do. However, mostly everyone sleeps better. I'm also an acupuncturist, so using acupuncture has also taught me that it's never about one goal. It's a holistic look at the body, and these are some markers, but there's also a quality of life and optimism, a stress reduction, a peacefulness that you can walk through each day with that can increase. And sometimes that means that the markers aren't always perfect. So it's a very unique and personal journey for each person.